So I think one of the disservices we've done to ourselves as ophthalmologists, and we're talking on the topic of maybe outcomes not being that great or having complications, is we have become so good at what we do that maybe the non-ophthalmologist or the layperson who's not a physician or a surgeon looks at cataract surgery and is like, oh, that doesn't look that hard. Like that's a 5-6 minute surgery. It looks so simple. And I've always felt that a hallmark of a really, really great surgeon is that someone who's an onlooker who maybe doesn't know what's going on looks at that and says, maybe even they won't say it out loud, but they'll say internally, I could probably do that, right?
Right.
That's when you're looking at truly just an amazing balance and dance of, just millimeter level accuracy and precision and hundreds, thousands, tens of thousands of repetitions that went into developing those subtle movements. I remember, we have people come in all the time and observe us doing surgery, and maybe you make some small maneuver and they're like, oh, that's pretty cool, and I have to think to myself, they don't understand the amount of time and effort that went into making that just small little pivot or that small little change in arc or degree that led to eventually the rest of the case going really, really well or something. There's just so much nuance involved. People don't understand how acute cataract surgery is, right? We have someone's eyes literally in our hands, their vision, the way they perceive the world. And that is a lot of responsibility to be working in a millimeter level space and to be able to manipulate these really, really micrometer fine tissues to deliver sort of vision and functionality and livelihood back to people. And when there's a complication, as surgeons, we can be hard on ourselves and really take that to heart and get down. But if you're going to be a surgeon, there's going to be complications. Any surgeon who says they don't have complications is either not a surgeon or they're lying, right? Or they don't operate. Right. So how do you handle complications or poor outcomes? How do you manage the pressure of surgery?
Yeah, I mean, you have to really work through that. I think you have to empathize. You have to be personal. You have to make sure you reach out to the patients that are having any kind of issue. You can't ignore it. You have to address it. It's easy to just put it out of sight, out of mind, but you want to be on top of it because, like anything, a complication could lead to other problems. It could start as a small complication, but they could, if you address it early and appropriately, you can often, minimize, issues. But if you ignore it or put it off, it could, lead to other things. So I think being aware, being on top of it, being, empathetic, all those things are important. Being straightforward, working with the patients, making sure that they know that you care about them, and you should care about them, and allows you to sort of make sure, number one, you address that complication, but also make sure that you don't try to repeat the same mistakes in the future. If you sort of put it out of mind, if you don't really care, then what's to say that you're not going to do it again or repeat the same issue? And you have to make sure you're staying true to yourself and true to your patients and trying to minimize every little thing that could be an issue as much as possible.
Everything you said is so spot on. I remember, not necessarily in my year, but I remember when I was a resident hearing other ophthalmologists, sometimes almost in like a braggadocious way, talk about, oh, I haven't broken a bag, or I graduated residency and I never broke a bag. And I never understood that because obviously you don't want to have any complications. But if I was having someone operate on my eyes, if I was having someone do cataract surgery on my eyes, I would not want to go to a surgeon who's never had a complication. I would want a surgeon who's experienced every possible complication in every type of manner, and who was diligent about learning from those mistakes, because God forbid if that complication were to arise or were to happen, they would be able to expertly navigate that because they've been through that before. And so I think it just comes back to what you said about, like, when we were reviewing surgical footage, trying to get better. Same thing goes sort of for complications. And there's the other aspect of that, which is now the human interpersonal quality, which is not just trying to avoid making that same maneuver that led to the complication again in the first place, but also getting better at empathizing with people and really trying to make sure that they understand you're there for them.
Right.